Good afternoon, everyone. My name is Mohammed Caliph, Senior Manager, Comprehensive Cancer Control at George Washington University Cancer Center. Through CDC funding and support, the GW Cancer Center is pleased to offer today's webinar, Policy Systems and Environmental Change, a PSE Primer. The webinar will begin with a 10-minute introduction to the Action for PSEChange.org online tool, worksheets and training, followed by two 15-minute presentations by members from Kentucky and Iowa Comp Cancer Coalitions. These will be followed by 10 minutes for Q&A. I would like to thank and acknowledge the support from CDC for this work. Before we begin, please take note of these housekeeping items. While everyone has been put on mute, please also individually mute your phones to ensure high audio quality when it comes time to the Q&A portion of the webinar. Please do not put your phones on hold, as that may disturb the session with hold music or your organization's hold recording. This webinar will be recorded and made publicly available, so many more people will have access to the information presented after today. The link to today's slides will be included in the chat box momentarily. During the presentations, if you would like to enter a question to be answered during the Q&A session, use the chat box or the Q&A box on the right side of your screen, and we'll make sure to field your questions to the appropriate presenter. In the send to portion, there's a drop box or drop down arrow. Please select the host or host and presenters so that we can have the questions and field it to the presenters in case they're in the middle of their presentation and they may not look at the chat to see your question. Our first speaker is Lisa Fuse. Lisa is a long-term cancer survivor and is a patient advocate at the Institute for Patient-Centered Initiatives and Health Equity at the GW Cancer Center. She was instrumental in the development of Action for PSE Change, an online policy systems and environmental change tool. She's involved with the evaluation of the GW Cancer Center's technical assistance activities and helps develop content for the Prepared Patient website. In her previous position, she worked with a government contractor and served as project manager for the National Cancer Institute's State Cancer Legislative Database Program. Our second speaker is Katie Beige. Katie is the program director for the Kentucky Cancer Consortium, the state's comprehensive cancer control coalition. She's worked with the University of Kentucky's Marquee Cancer Control Program since 2001, previously as informational specialist and training manager for the National Cancer Institute's Information Service of the Mid-South. Katie serves on multiple state and national cancer control committees, including the Steering Committee for the GW Cancer Center's Comprehensive Cancer Control Technical Assistance Project, ACS's National Patient Navigation Roundtable, and is chair of the Kentucky Leads Collaborative Community Advisory Board. Finally, our third speaker is Denise Attard-Sacco, who is the Policy and Implementation Specialist with the Iowa Care for Yourself Wise Woman Program at the Iowa Department of Public Health. She received her Bachelor's of Science with honors in Environmental Health from the University of Malta and her Master of Public Health degree from Walden University. Denise is also a certified health education specialist and has over 18 years experience in public health. Her areas of interest include projects that utilize the social determinants of health and evidence-based interventions as a way to evaluate and bring about changes in community health. By the end of the presentation, you will be able to recognize Action for PSEChange.org as a resource for policy, systems, and environmental change technical assistance, demonstrate familiarity with the Action for PSEChange.org content, including the 7 steps of the PSE Change process, state, tribe, territory examples and resources, and discuss components of successful PSE Change initiatives and write a success story. And now I'll turn it over to our first speaker, Lisa Fuse.
Thank you, Mohammed. Good afternoon, everyone. Thank you for having me. Let's begin our overview of GW's PSE Change products with the Action for PSE Change online tool. I'm going to start right here on the home page. which provides an overview of policy, systems, and environmental, or PSE Change. And in a nutshell, PSE changes are public health changes that enable healthy options and allow the healthy choice to become the easy choice. So as you scroll down this page, we have a table that helps to distinguish a policy change from a systems change from an environmental change, although as you'll see, there is a lot of overlap. For a little more information, click on Learn More about PSE Change. Now there's a lot of information on this page, but we'll find a comparison of PSE Change with traditional public health programs. And there are links there if you'd like to go even a little deeper. And then we've got the 7 steps of the PSE Change process. And we are going to go back to those steps in just a minute. We also have a link right here in the middle for our new PSE training, and I'm going to talk about that later in the presentation. And on this page also you'll find an excellent resources, the Policy Systems and Environmental Change Resource Guide, which was developed by the American Cancer Society on behalf of the Comprehensive Cancer Control National Partnership. So now let's go back to the 7 steps. The easiest way to find them is to use the menu at the top of the page, and as you can see, when we hover over it, the 7 steps are revealed. And I just want to give a quick caveat. These steps are listed here sequentially, but they aren't necessarily followed in this order. They can take place at the same time or in a completely different order. And in the interest of time, I'm going to provide an overview rather than review each step in depth. So step 1, engage, is where you'll build partnerships with community stakeholders. Step 2, scan, is conducting an environmental scan to determine what action should be taken within the broad health issue you want to address. Step 3, assess, is where you identify evidence to support your position. In step 4, review, you'll look at the feasibility of your proposed PSE change intervention to determine if your goals and objectives can be implemented. During step 5, promote, you will use various forms of media to communicate to stakeholders the need for PSE change prior to implementation in order to help lessen potential resistance. Step 6 doesn't really need a lot of explanation as it's the implementation step. And finally, step 7 is the evaluation of your initiative. And keep in mind at this point that evaluating the process employed during the implementation of the intervention is just as important as looking at the outcomes. So to give you an idea of the information available on each page, let's take a closer look at step 6. So this page will explain what the step is. It will provide a link to case studies that have been submitted by states, tribes, or territories that highlight the particular step. And it also describes how to use data to support that step. The page also contains a list of relevant tools and resources, a worksheet, a template, and information from the National Partners PSE Guide that I mentioned just a minute ago. So I just want to give you a little information about the worksheets. GW staff have developed worksheets that correspond to each step to help users navigate the PSE change process. So these worksheets could be useful to work through during coalition meetings when strategizing about PSE initiatives. And then just a word about the template. They're different on every page, but for step 6, the template is a fillable form called a PSE or policy agenda. Adapted from the National Partners PSE Guide, you can work through these steps to inform your decisions about pursuing PSE Change. And as I mentioned, this is a fillable form. So if you complete and submit it, you will shortly receive back an editable PDF of your agenda that looks like this. And I wanted to show you another way that's a little more direct to access that form in case you're looking for it. Back to the home page, click through until you see Plan. Click on Plan, and it opens back up to exactly where we just were. So when we were on the Step 6 page, I showed you how to find case study examples that correspond to that particular step. But you can also find all of the stories that have been submitted. Just click on PSE Change Examples, and you can also use the home page's rotating header to get there. So on this page, you will see links for all of the PSE Change case studies, including the ones from Iowa and Kentucky that Denise and Katie will be telling you about shortly. Just want you to see the whole list. And then I'm going to click on DC so you can see the details of a case study. So each case study has a very similar structure. We have the name of the initiative, the step addressed by the case study, the problem and the solution that has been identified by the program or coalition. And then there are actions and results that detail the activity that was undertaken to meet the goals and objectives. There is also a set of questions that is specific to each step that have been answered to help other programs and coalitions learn how the PSE initiative was actually implemented. So hopefully what you've heard so far has given you ideas about initiatives in your community that might lend themselves to a great case study. So think about writing your own success story. And I'm going to show you the easiest way to do that is, again, from the home page. Using the rotating headers, just click through to share. Click on this form. And this is basically a guide to help you write your success story. Keep in mind that each success story only needs to highlight one step of the process. We recommend read through the whole form, and it'll give you an idea of what step may be most appropriate for your success story. So what you'll do is up here, give us your contact information, and then just scroll down to the step that you've chosen and simply answer the questions. Then you can use the text you've entered to create a Word document of your case study. And something that's really helpful as you do that is to go into the examples we just looked at, and it will give you a great idea of the sections that are involved and the way we use citations, and you can build your story from there. And you can also work directly with me, so if you are interested in doing this, feel free to email me and we'll get started. And the last section on the website I wanted to mention is the resources section, because it contains a variety of tools to assist with your PSE Change efforts. I just want to mention specifically the PSE worksheets, because earlier we talked about the Step 6 sheet, but this section of the site lists all of them. And if you click here, you find our resource guide that basically has compiled all of the 7 worksheets, along with some additional information about PSE. So this could be really helpful, if you want to print the whole guide, take all of the sheets to a meeting to help facilitate your discussions. And then also from the resources guide, you can click on PSE Change Training, and the first item listed is GW's training that we saw a little bit earlier. If you click here, GW's Online Academy will open up. And if you haven't had an opportunity to go onto the Online Academy, you'll see here a number of different training classes that are all free and available for you to take. So the first thing I'd recommend doing when you get to this page is just scroll down to the PSE training and copy this enrollment code. If you haven't been here before, the first thing you need to do is register for an account, which will take about a minute. I'm going to click here, but because I have already got an account, it's asking me to log in. But what you would do is simply click here, and I think there are 4 fields that you have to fill in. It really is very quick. And then you log in. You copied that enrollment code, and you simply paste it right here and redeem it. Since I've already been into that course, I'm going to go into my listed courses to access it. The first time you enter this, all of the different courses will be locked. Simply read the welcome letter, complete the pre-training assessment, and then all of the lessons will unlock for you. You can take all of them, you can take one of them, you can go in any order you like. But the one thing I would like to mention is the supplement to Lesson 5, because this does not appear on the website. And this lesson is entitled Educating Stakeholders, and it provides information for CDC grantees about permissible activities. So I just wanted to point that out. So that is our overview. Just to recap, the takeaway points from the presentation, from the homepage rotating header, you can really find most of the topics that we talked about. The first was the policy agenda right here from Plan, our case studies, how to write your own case study, how to find resources, and how to access the training. So before we continue on to our next speaker, I just want to take a moment to ask our audience 2 brief poll questions. So thanks. I can see we're already getting a lot of answers to our first question, which basically addresses the resources we've discussed. The first, just which one you might be most interested in using if you had to choose one. And great. It looks like, well, there's interest in all of them. Super. It's nice to see a lot of people are interested in the training and both of the other resources. So let me give you another second. There we go. And then the second question. So the second question, as you can see, is specific to the website. What resources do you think you'll use the website most often for? And I won't read all of the answers. I can see you're already entering your answers. All right, thank you so much. If you have any questions about what I went over, I'll be happy to answer them at the end of the webinar during the Q&A. And now I'd like to turn it over to our next speaker, Katie Beatty. Katie?
Hi there. Thank you so much for this opportunity. I really appreciate it, and I'm very happy to share the story of Kentucky with you all. And it is a story that has a lot of chapters, but I'm going to, in a brief period of time, try to convey to you what worked for us. And for Kentucky's success story that we submitted on the Action for PSE Change website, it had to deal with colon cancer. So that's what I'm going to talk a little bit about today. First of all, Kentucky has seen a lot of success, and of course that's, you submit mistakes for sometimes are successes as well, but for the one that I'm going to chat about today, it has been a success. Screening saves lives, as those of us in the cancer subculture know, most particularly in colon cancer. And in the past almost 20 years, we've really seen a rise in screening rates in Kentucky. We used to be 49th in the nation. We are now 17th in the nation for screening rates. And as you can see by the slide, what that has meant is, coupled with increased screening, is going to be a decrease over time in incidence and mortality. So we've seen almost a 30% decrease in mortality in Kentucky in this time period, which is kind of the holy grail of colon cancer screening effects that you want to see. And basically what that means in actual people is that every year, 350 Kentuckians who would have gotten colon cancer don't get colon cancer anymore. So imagine the morbidity and mortality that is avoided because of promoted screening. So how did we do it? How did we make progress? I'm going to try to give you a brief example from each one of these 4 steps. And basically, just to give you the broad swath, it is a long-term commitment, a commitment across sectors, which was and continues to be very challenging. I will say that. Look at the partners I have listed here. This is just a handful of those who've really been hand in hand since the beginning of that graph. The State Health Department, the Cancer Coalition, nonprofits, health systems, advocacy folks, and provider groups. And really within each one of those, trying to identify who might be a champion. Who would be the physician that would be willing to go before a legislative state health and welfare committee meeting and share why they think colon cancer screening is important. Likewise, who might be your go-to person in the public health state health department? We were lucky enough in our early years to identify champions in each of these areas. And they really helped us to get to that next step, which is where the speaker is. Cancer ended up being the convening body for these folks, and we were able to coordinate people working together as opposed to going back to their own silos and doing their own thing in their own organization. We tried to find some things that we might be able to do together that we couldn't do by ourselves. And then probably one of the biggest success stories for Kentucky and what I'm sharing with you today is about some of the policies that we were able to put in place that reduced barriers and expanded the access to colon cancer screening. This graph certainly doesn't touch on everything that happened in Kentucky, but it gives you a smattering of what happened over time for Kentucky. And it coincides with the graph I showed you earlier. Basically, the takeaway from this graph to you, I would think, one of the big ones, is that it takes time. As you can see, this has been going on for quite a while. That's a lot of meetings, that's a lot of room reservations and minutes taken and agendas put together, and just kind of the hard work of keeping in contact with partners is what's not pictured on this graph. A couple things I wanted to point out to you, though, that I think are interesting. As you all know, one of the things I can't take credit for, but is Kentucky definitely benefited from, is when Medicare began to cover colonoscopy coverage for all. That was, as you can see, this graph begins to go up from there. It's very exciting and was a huge boost for us here in Kentucky, and hopefully for you all as well. So that was one major policy change that we had no hand in getting passed, but certainly benefited us. Another one I want to point out is we had a colon cancer prevention project that was started here in Kentucky. That's basically a nonprofit So we had a nonprofit that was willing to go to the mat for us when it came to advocacy, and I'll share a little bit more about that in a minute. And they were completely focused on colon cancer and also really focused on policy. Couldn't have asked for more with that. And then one of the other high points that I wanted to point out happened in about 2008 on this graph. We convened people in a statewide summit. And I know some of you who work in cancer control might be rolling your eyes thinking, oh no, a statewide meeting, those can be so difficult and expensive. But I will tell you, it was a great investment of our resources, and we convened everyone for the first time in a little before 2008 to discuss colon cancer only. Not a summit that covered anything else. It was strictly colon cancer, and the momentum in that room carried us forward, and we were able to get some of these things accomplished as a group. So I'm gonna pull out one thing. You'll see where that star is on my graph. That was something that I'd like to highlight for you and tell you what happened and how it impacted our work. So I mentioned that on that graph, a lot of what's not seen is the meetings and the agendas and all that goes into getting partners on the same page. Well, when we had partners in the same room very early on, we decided to try to figure out what are the gaps in Kentucky? Why are we so low in screening rates? So we looked to our cancer registry. We have a strong cancer registry. We looked to the BRFIS questionnaire, Behavioral Risk Factor Surveillance System questionnaire, and we made a matrix of, okay, who is doing what around the state? And we had a lot of sticky notes. Again, this was part of that statewide meeting. And then we dreamed, okay, we know, once we know what our resources are, let's dream, what would you, now that you have this idea, what would you do if you had the money to actually implement? Where would you go first? You know, how would your organizations work together? Would you focus it on public awareness? Would it be focused on provider education? And we really tried to look to our state cancer plan, the objectives that we chose at the state summit meeting, and said, if I was going to put a dollar sign on that, if I was going to do a public awareness campaign, let's say, for colon cancer, what would that cost, and how would we get it done? So it was some what-if dreaming. So these partners came together to make a plan, and we met regularly to talk about that. Now, some of these things you can plan for, and some of the things you can't. So we had convened everyone. We had done what we felt like was due diligence in going to legislative health and welfare committee meetings. I told you some of our champions testified. They made the business case that CRC screening not just saves money, it saves lives. And we tried to find legislators that had experienced colon cancer in their family or even themselves. And we were very, get lucky in Kentucky. We were very lucky in that sense that we found some very friendly legislators that were willing to take a stand for us and push some of our things forward. So some of that was planned. What we couldn't plan was we had a survivor that got in touch with us and said, hey, I saw this cancer plan online. I'm a fundraiser. Is there something that I can do to help you implement this plan? You can't make that up. And a new 501c3 was established through that. And the only reason I bring that up is to not make you jealous, but to let you know that sometimes you can do your due diligence and then, you know, blessings come from nowhere. And so don't be discouraged by meeting, planning, dreaming, and you don't know what will come. So that 501c3 was a foundation that was able to accept not only donations, but was able to do some fundraising, some matching of state dollars to colon cancer screening in Kentucky. So let me tell you what that looks like. So we're meeting, and of course we want to have a colon cancer screening program in Kentucky. We did not have CDC funding from the federal level. So this colon cancer foundation said, well, how are we going to fund this if we don't have federal money? What they did is they got those friendly legislators together and they said, if we were to raise some funds, would you be willing to match those funds? And the right legislators pushed it forward. And while it took a long time, you can see we got the screening program put into legislation but not funded. That's always fun. We were able to fund it by, in 2012, the governor actually put some money towards it. So that was super exciting. So that was years of work that finally created a state cancer program that was hugely successful. And some policy, like I said, some you plan, some you don't. We had no expectations or had nothing to do with the fact that Medicaid expanded, but it sure did in Kentucky, and that brought with it a lot of change. And so some of the policy successes that we had and some of the policy efforts that we made towards colon cancer screening changed after that, and I'll tell you that in just a minute. But basically what I wanted to let you know is that while policy was happening, as you all know on this phone call, some of you are state health employees, others of you might work for a university, and so it's difficult sometimes to do policy from the hat that you wear. So we had a lot of other partners at the table that were doing things to build momentum in the community so that those legislators said something is happening. You know, I'm seeing this on television. I'm hearing about it on the radio. I'm having people call me and say we should fund colon cancer screening for my constituency. So I wanted to just give you, I won't go through these one by one, but I'm happy to answer questions about any of them. These were some of the initiatives that the organizations in our coalition took towards colon cancer. Now you might say, well, gosh, some of those look like they are in individual silos. What I feel like is unique about this is these people met together monthly under the Cancer Coalition's umbrella for years, and letting one another know what the other entity was doing was a huge success in and of itself. Trying to get different partners from these things you're seeing here work together. So if one partner was going to say, that first one, go into provider education, go into a primary care practice with a message, well, what if another organization had had some materials they wanted to go? What if they went together? And that was something that was revolutionary for us here. I'll tell you that we have 7 colons now that are huge. Those of you that have seen them, they're huge inflatable colons that are, we started with 1 back when that timeline started, and now we have 7, and there's been some real momentum we've gotten from those with public relations and press releases and that kind of thing. But as you can see from this list, a lot of partners doing a lot of work. We kind of branched into public awareness, provider education, and policy, and these are some of the things that came out of that partnership. Now, I will tell you, as this story goes on, that one of the best attributes of our coalition is that we can adapt to change. I think that being able to adapt to change is the key to sustainability. And as you can see from this slide, one of the things that was really a struggle to us was that even though that Medicaid had been expanded, which is a great thing, what it meant is there weren't as many people that needed our free colon cancer screening. They were covered under Medicaid, which is great. But it meant that we had to kind of readjust what we were putting money towards in our state screening program. And it also meant that when we got a Republican governor, after Medicaid had been expanded, some of those funds were cut from the budget. So that was definitely difficult and has kind of forced us to realign what our goals are for policy. It's forced us to refocus our efforts from the state screening program back to some of those initiatives that weren't dependent on state funds and that were perhaps promoted more through existing funds in universities and nonprofits. So what we're doing now is we are meeting no longer necessarily to try to get a state-funded screening program, although we want to be at the ready if that money comes back. We're trying to look to focus in other areas, and I want to show you. I love Dan Rather, and one of his quotes in a recent book he did was called "Steady On." It was advice his dad gave him when things were uncertain and he didn't know what to do, and his dad just said, "Steady on, Dan." And so that's what we did amidst all the policy changes that have happened for us that might be discouraging in the past couple of years. We're looking forward and we're doing what we can. Part of that are some of these policies that really have nothing to do with a state screening program. They're just trying to reduce barriers to colon cancer screening. So when you look at the community guide and it tells you what works, it's reducing barriers. Here are some of the ways that we did that, and I'm happy to get you in touch with the folks that were able to get those passed. Key to getting those passed were one of our partners was willing to put money towards a lobbyist, a nonprofit partner that was, I mentioned earlier, the Colon Cancer Prevention Project, and they worked with the American Cancer Society, Cancer Action Network, and really worked hard to get some of these things passed. We're one of the first states in the country to really require all health plans to not only cover a colonoscopy, after a positive fit, but also ensure that if someone has signed up, so to speak, for a screening colonoscopy and they get polyps removed, that now it's still considered a screening. It's not able to be then coded as a diagnostic, hopefully, because people then wake up with a bill they hadn't expected. So those are some things we were able to do for policy without any money, but with a lot of hard work on our policy partners' part. We're also doing what we can by thanking providers. This is part of our thank you campaign that Kentucky has done that we're super proud of, and it's going on right now during March Awareness Month. We're going around a roadshow and thanking our providers for their hard work. So again, the takeaway I want to give you is change takes time. I would look towards the best practice community guide interventions, which really inspired us, and we made sure that if we did something, it was in that community guide and already proven to work to reduce colon cancer. So we focused on reducing our barriers. We coordinated partners to do public awareness, one-on-one education, small, media, group education. And then, of course, we did provider education as well as a best practice. But I just want to encourage you that it takes time, and don't be afraid to sweat a little bit along the way. Again, one quick thing on my last slide here is that despite our challenges, I really feel like it's helpful to focus and celebrate on your successes when you can. So we've really tried to do this the past year. With some of those discouraging policy and financial changes, we're looking at some really great colon cancer screening rates. One of our area development districts down there in the southwest corner, Purchase, has reached the 80 by 18 goal. They're at 83% in their screening rates. And I will tell you that some of these other communities that look like, oh gosh, only 63% screening rate, to be honest, that Gateway District has increased 30% in their screening rate in the past 10 years. So find those things to celebrate and focus on those. And then what are we going to do looking forward? Kentucky's looking to focus on some of our disparate populations now that we've got some raising screening rates. We want to look at our African Americans who have a higher incidence rate and mortality rate from colon cancer than whites do, in our Appalachian area, which seems to be, their rates are not going as quickly in the right direction as other areas of our state. So my parting word to you, maximize your resources, meaning look to people who have already done this well and ask them how they did it. I'm willing to share some of our legislative language here from the Kentucky Cancer Consortium. I'm willing to share experience to connect you with physician champions who are always willing to chat. And I will tell you, when we started this process back in 2006, we had no clue how to move forward with policy. And I'm telling you, you have a resource here in the, not just the website, the Action for PSE Change website I have up here, which our story is on, but in the people behind this website are more than willing to come alongside you and help you figure out what policy changes are best for your coalition and how to achieve them. We didn't have that back in 2006, so I sure hope that you'll take advantage of that moving forward. So thank you, Mohammed, and I'm happy to answer questions at the end. I'm going to hand it over now to Denise. And Denise is our next speaker, and she's going to share with us a little bit of the story from Iowa.
Hi, good afternoon. Thank you for having me on this webinar. Great presentations from both Lisa and Katie. Let me see. Okay. Oh, here we go. Sorry about that. So I have enough for the next couple of minutes. We're going to take a look at what radon is and its impact in Iowa, and then we'll talk a bit about the Polk County Radon-Free Homes Initiative. So on to the next slide. So what is radon? Okay, so what is radon? So radon is a naturally occurring, colorless, odorless, and tasteless gas. It is an alpha emitter, alpha particle emitter. That means it emits radiation. And radon gas concentrations are measured using the units picocuries per liter of air. So outdoor radon levels are normally at 0.4 picocuries per liter. It is inside buildings that radon can become a problem because radon gas levels can easily become concentrated within buildings. So for this reason, the United States Environmental Protection Agency recommends that you mitigate your home for radon if the results of one longer-term radon test or the average of 2 short-term radon tests show levels of 4 picocuries per liter or higher. So moving on to the next slide. So some information of the impacts of radon in the U.S. So radon is the second leading cause of lung cancer in the United States and is also the leading cause of lung cancer in non-smokers. And if you are interested in learning more about radon and its impact on health, don't hesitate to visit the Agency for Toxic Substances and Disease Registry web link that is showing up on your slides. So if you now look to the left side of the slide, you see that the United States map, which shows a kaleidoscope of colors there. And I'll explain a bit what those colors represent. So the dark pink areas are also known as Zone 1 areas, and they indicate counties across the U.S. which have a high potential for elevated radon gas levels. So when we say elevated, we're referring to 4 picocuries per liter of air or higher. So then the dark orange areas, which are known as Zone 2 counties, they have a potential for more moderate levels of radon gas, while the yellow areas are counties which have a potential for lower radon gas levels. So if you look at the map, it clearly shows that all counties in Iowa are Zone 1. That is, they have a higher potential for elevated radon gas levels. That is 4 picocuries per liter or higher. So how is radon a health risk? So as I mentioned earlier, radon emits radiation, and in the process forms what we call radon decay products. So these radon decay products are actually small solid particles, and they can easily become attached to dust particles or aerosol present in the air that we breathe. So when we breathe in with these radon decay products, they tend to be deposited on the lung epithelium. And the epithelium is the cells which make up the walls of our lungs. So now these radon decay products can in themselves undergo radioactive decay, and in the process they emit more radiation and can thus deliver a critical dose of radiation directly to the lung, and which can lead to radon-associated lung cancer. So with respect to some information on radon in Iowa, Iowa leads the nation in the percent of homes that have elevated radon gas levels, so with 7 in 10 homes in Iowa showing this. And it causes 400 lung cancers deaths per year in Iowa. Unfortunately, I myself lost a friend to radon-induced lung cancer. And radon can enter our homes via seepage from soil surrounding or underlying homes. For example, through sump holes, dirt floors, floor drains, cracks in foundations, and also through concrete floors in basements. So let us now move on to the Polk County Radon-Free Homes Initiative. So this initiative was developed on the environmental justice premise that everyone has the right to enjoy the same degree of protection from environmental and health hazards. Therefore, starting out, this project had 3 main goals: raise community awareness on radon, provide educational outreach on its public health impacts, and also providing radon testing and mitigation services at no cost to homeowners for targeted low-income family homes in Polk County, Iowa. So let's talk a bit about the partnership which brought about this initiative. So the Iowa Cancer Consortium was the project lead and worked with the Polk County Health Department and other stakeholders. The initiative was focused in Polk County, Iowa, and it formed part of the Polk County Lead Abatement and Healthy Homes program. This program is led by the Polk County Health Department. And the whole initiative was funded actually through 2 grants, one from the Department of Housing and Urban Development and one from the Environmental Protection Agency. So looking at the participation criteria, and one must keep in mind that since this Radon-Free Homes initiative was part of the lead abatement program in Polk County, some of these criteria listed here would pertain more to the lead abatement program. But since we're doing 2 programs together, These were all the homes that homes that were tested for radon had to satisfy. So in addition to have the house that must be within Polk County, the home must have been built prior to 1978. That does not mean that a home built after 1978 would not have a radon problem. But for this particular project, we had this criterion that it had to be satisfied. In addition to that, the house must be owned by the occupants, not rented. It must have children under 6 years of age living in it or visiting it. The house must not have undergone recent lead remediation, and the family income needed to be at or below 80% of the median family income. So how did we identify eligible participants? So these were identified through the Polk County Lead Abatement Program, which is led by the Polk County Health Department, and through outreach conducted by the Iowa Cancer Consortium with organizations. The outreach, I wanted to point out that the outreach was carried out with more than 25 organizations and agencies, and these included community churches, schools, daycare centers, clinics, and other agencies within Polk County. So with respect to the educational outreach that was part of the initiative, this took form of meetings with representatives of key agencies, presentations at neighborhood meetings, exhibits at community fairs and events, and also setting up temporary displays at community agencies and centers, as you can see in the pictures on the slides there. So with respect to outreach materials, these included project cover letters, Radon-Free Homes Initiative application forms, income limits summary documents, and also copies of the Radon and U brochure. So this brochure was developed specifically for Iowa. It was developed by the Iowa Cancer Consortium, the American Lung Association, and also the Iowa Radon Coalition. And the brochure provides educational information on radon, its impacts on health, and radon testing and radon mitigation. And it's also important to point out that all these materials that I listed were made available in both English and Spanish, so as to increase opportunities for project outreach amongst our target communities. So with respect to home radon testing, this test consisted of a short-term radon test, which hang, as you can see the kit and the picture on the slide, would hang the test kit in the basement of the home for around 3 to 6 days, and then it would be sealed and sent for analysis. We did record some data at the time of sampling, such as the start date and start time, end date and end time, home address and test kit location, and average temperature of the home. So after we've sent in the test kit for analysis, if the radon levels that we received back were 4 picocuries per liter or higher, then we'd carry out a second short-term radon test. Then we'd look at the average of the two tests, and if the average was equal to or greater than 4 picocuries per liter, then the house would be eligible for radon mitigation. So just a quick look at the results of the first part of the initiative. So in total, 53 homes completed radon testing, which is a little bit higher than our target of 48 homes. 16 homes received radon mitigation at no cost to the homeowners. All the families that participated in the initiative received educational information on the impacts of radon on health, as well as copies of the Radon and U brochure. None of the participating families had ever previously had their homes tested for radon. And the majority of families whose homes were tested indicated they felt more knowledgeable about radon and its impacts following participation in the Radon-Free Homes initiative. So we did encounter a number of barriers for families to and homes to participate in the Radon Home Initiative, an Radon-Free Home Initiative. So, for example, even though families would satisfy the income criterion, they rented the property rather than lived in it, or their home had been built after 1978, or their home had undergone recent lead remediation, or they did not have children under 6 living or visiting the home, or otherwise lived within an apartment complex. And let's say you satisfied all the eligibility criteria. If and your home was tested and it was found to have 4 picocuries per liter or higher, so it would be eligible for mitigation. If you had unpaid property taxes, the grant funds could not be used to pay for your home radon mitigation. And then in addition, families whose income was above 80% the median family income, and so they were not eligible to participate in the Radon-Free Homes Initiative. But for them, radon mitigation was still an expense. If you had to, for example, choose between providing food for your family or putting food on the table and radon mitigation, I think it's obvious what the choice would be, and it's not going to be radon mitigation. So these families still had a need for radon mitigation that needed to be addressed. So, and then some more queries we received from the public, such as we were asked by low-income families who are ineligible to participate. So are there any other programs out there for low-income families, or those families whose income was slightly above the 80% of the median family income, and they could still not afford to do radon mitigation? Whether there were any programs that at least, provided partial financial assistance. So this made us think a little bit more, and we decided to expand our project into doing a thorough community scan within Polk County, and we looked at banks offering or would be interested in offering low-interest loans for home radon mitigation, as well as companies and community organizations that already provide subsidized home improvements and repair services for low-income individuals or families, and whether they included assistance with radon testing and mitigation or something that they would like to interested in including in the future as part of their work portfolio. And as you can see on the slide, we contacted many organizations, banks, and home improvement companies within Polk County. So from all the information and resources that we investigated, we came up with this financial resources list that is currently showing up on your screens. It includes banks that offer low interest loans for radon mitigation, as well as community assistance organizations such as Habitat for Humanity, who moving forward were ready to contract with certified radon mitigators to provide radon mitigation services as part of their community assistance programs. So moving forward, the financial resources information has been distributed to organizations in Polk County and made it available to the public that way. It will be updated as additional resources become available. And the Iowa Cancer Consortium, through its radon work group, is now seeking to identify financial assistance resources for radon testing and mitigation in other counties across Iowa. We've seen that this has been a success, so we want to repeat the success in all other counties across Iowa. So this project was successful because of the great collaboration between all the project partners and the communities who work with. In fact, if you look up this project on the Action for PSE Change website, as Lisa showed us earlier, you would find it listed as an example under the first step of the PSE Change process, which is Engage. So great big thanks go to the Iowa Cancer Consortium for their great leadership, the Polk County Health Department for their collaboration, all the community centers, churches, neighborhood associations, etc., that helped us with project outreach to reach out to our target population, as well as the agencies and banks that form part of the financial resource list. And last but definitely not least, to Miss Ellie Bain. She was an outreach specialist at the time with the Iowa Cancer Consortium. She's now moved to Wyoming, and she was a great colleague, great friend, and Wyoming are very, very lucky to have her. And I know she's on the attendee list, so if you don't hesitate to reach out to her and tell her great job. These are just some resources and references that I used, and I would now like to pass it on back to Mohammed. Thank you.
We really thank you for your time, and thank Lisa, Katie, and Denise for their time as well. We'll leave it open for a few more minutes for you to complete the evaluation. Thank you again, and have a great afternoon.